Friends, stop taking whatever your doctor gave you for poor circulation and listen to me very carefully for the next few minutes, because what I'm about to share with you could literally change how you feel in your legs starting this week. I'm not exaggerating. I've spent over 3 decades studying vascular health, and I can tell you with absolute certainty that the most powerful tools for improving blood flow in your legs are sitting in your kitchen right now, not in a pharmacy, not behind a prescription counter, in your kitchen. Here's what nobody tells you. After the age of 60, your arteries begin to stiffen at a rate that accelerates every single year. A landmark study published by the American Heart Association found that adults over 65 with poor lower limb circulation are 74% more likely to experience mobility limitations, falls, and cardiovascular events within a 5-year window. 74%. That's not a small number. That's nearly 3 out of 4 people. And the most frightening part? Most of them had no idea their circulation was declining until it was already seriously affecting their daily life. Now here's the exciting part, and I want you to stay with me all the way through this video, because number 2 on our list today is something almost nobody is talking about. And when I first read the research on it, I had to read it twice. It is that surprising. It works through a completely different mechanism than anything else on this list, and it may be the most underrated circulation booster in the world for people over 60. Before we dive into the full countdown, I want to ask you something personal. Drop your age in the comments below and tell me, do you experience heaviness, tingling, swelling, or cramping in your legs, especially in the afternoon or evening? I read every single comment on this channel, every one. I want to know what you're dealing with so I can keep making videos that actually help you. If you're watching this right now, you're already doing something right by seeking this information out. We are counting down from 5 to 1, 5 drinks ranked from helpful to absolutely transformational for blood flow in your legs. Let's begin. Number 5 is one that surprises people every single time I bring it up in my practice, and that is Tart cherry juice. Now I know what you're thinking, cherry juice, really, Dr. Mandell? Hear me out, because the science here is genuinely impressive. Researchers at the University of Michigan conducted a study in which older adults who consumed Tart cherry juice daily for 12 weeks showed a 21% reduction in systemic inflammation markers, specifically a compound called C-reactive protein, which is one of the primary drivers of arterial stiffness in people over 60. Think of inflammation in your arteries like rust building up inside a water pipe. Over time, that rust narrows the pipe, slows the flow, and eventually causes the whole system to work harder just to get water where it needs to go. Tart cherry juice acts like a powerful rust remover from the inside. What makes Tart cherry juice uniquely effective for aging bodies is its exceptionally high concentration of anthocyanins. Those are the deep red pigments that give the cherries their color, and these anthocyanins have been shown to specifically target endothelial cells, which are the cells that line the interior walls of your blood vessels. After 65, endothelial function declines significantly, reducing your body's ability to dilate blood vessels on demand. Tart cherry juice helps restore that flexibility. I had a patient, Margaret, 71 years old, from Scottsdale, Arizona, who had been dealing with constant leg heaviness and poor sleep for 2 years. After 6 weeks of drinking 8 ounces of unsweetened Tart cherry juice every evening before bed, she told me she felt like her legs had come back to life. She started walking her neighborhood again for the first time in 18 months. For best results, drink 8 ounces of pure, unsweetened Tart cherry juice in the evening, preferably 30 minutes before bed. The melatonin naturally present in Tart cherries also supports overnight tissue repair. To enhance absorption, pair it with a small amount of healthy fat. A few walnuts or half an avocado works beautifully because the fat-soluble antioxidants absorb more efficiently in the presence of dietary fat. Scientific references are always in the description below. Number 4, and this one has been used for thousands of years but is now finally getting serious scientific attention, is ginger tea, specifically fresh brewed ginger root tea. A study published in the International Journal of Preventive Medicine followed participants between the ages of 62 and 79 who consumed ginger daily and found significant improvements in peripheral blood flow, that means blood flow to the extremities, your legs and feet, within just 30 days. The key compounds here are gingerols and shogols, which are powerful natural vasodilators. Vasodilation simply means the widening of blood vessels, allowing more blood to flow through with less resistance. Here's why this matters, especially as we age. After 70, your body produces substantially less nitric oxide, which is the molecule responsible for telling your blood vessels to relax and expand. Ginger works by stimulating alternate pathways that achieve the same effect. Think of nitric oxide as the foreman on a construction crew who gives the signal to open the gates. When the foreman starts calling in sick more often, which happens naturally with age, ginger acts like a backup foreman who steps in and gets those gates open anyway. Ginger also has remarkable antiplatelet properties, meaning it gently reduces the tendency of blood cells to clump together and form the microclots that contribute to sluggish circulation in the legs. This is particularly important for seniors because reduced physical activity and spending more time sitting leads to slower venous return. The blood has more difficulty making its way back up from the legs to the heart. To prepare this correctly, take a 1-inch piece of fresh ginger root, slice it thin, and simmer it in 2 cups of water for 15 to 20 minutes. Do not use ginger powder from a spice jar. The active compound concentration is significantly lower. Drink 1 to 2 cups daily, ideally mid-morning when your circulation is ramping up for the day. For synergy, add a squeeze of lemon and a small pinch of black pepper. The piperine in black pepper enhances the bioavailability of ginger's active compounds by up to 30%. I have recommended this combination to hundreds of patients over the years. A gentleman named Harold, 78 years old, from Baton Rouge, Louisiana, told me after 8 weeks that his feet were finally warm again for the first time in years. His wife cried when she heard him say that. Right here, between number 4 and number 3, I want to pause and ask you to do something for me. If this information is helping you or someone you love, please hit that like button right now. It takes 1 second and it tells YouTube to share this with other seniors who need to hear it. And if you haven't subscribed yet, please do that right now. We put out new evidence-based health content for people over 60 every single week, and it's completely free. It costs you nothing, and it could save your life. Thank you. Now, number 3. Number 3 is pomegranate juice, and the research behind this one is so compelling that major cardiovascular research centers around the world are now actively studying it. A clinical trial conducted at the Preventive Medicine Research Institute in California found that seniors who drank 8 ounces of pomegranate juice daily for 3 months experienced a 30% improvement in blood flow through the carotid arteries. Those are the large arteries in the neck that supply blood to the brain. And similar improvements were observed in peripheral circulation throughout the lower body, 30% in 3 months. The secret lies in pomegranate's extraordinary concentration of punicalagins, a class of antioxidants found almost nowhere else in nature at these levels. Punicalagins are converted by your gut bacteria into a compound called urolithin A, which has been shown in research from the University of the Sorbonne in Paris to actually restore mitochondrial function in aging muscle cells. Your mitochondria are the power plants of your cells, and after 60 they begin to dysfunction, which contributes not just to fatigue, but to the reduced ability of muscle tissue in your legs to extract oxygen from the blood flowing through it. This is a crucial distinction. Poor leg circulation isn't always just about how much blood is getting to your legs. It's also about whether the cells in your legs can actually use that blood effectively. Pomegranate juice addresses both sides of that equation. It improves arterial flexibility and blood delivery while also improving cellular oxygen utilization. I want to tell you about Patricia, 74 years old, from Portland, Oregon. Patricia came to me after being told by another physician that her leg pain during walking, a condition called claudication, was just something she would have to live with. After 12 weeks of daily pomegranate juice combined with gentle walking, her walking distance before leg pain onset had increased by over 60%. She sent me a photo of herself hiking a trail she hadn't been on in 6 years. I keep that photo. Drink 8 ounces of 100% pure pomegranate juice, no added sugar, no blends in the morning with breakfast. Pair it with vitamin C, either from a glass of orange juice or a supplement, because vitamin C significantly amplifies the antioxidant activity of punicalagins and improves collagen synthesis in arterial walls, which keeps blood vessels supple and flexible. Number 2, and this is the one I promised you earlier, the one that made me read the research twice, is beet juice. Now, some of you may have heard of beet juice before, but I promise you that what you're about to hear goes far beyond anything you've seen in a typical health article. A groundbreaking study published in the Journal of Applied Physiology and I want you to look this up in the description, found that older adults between 60 and 75 who consumed beet juice before physical activity had 38% greater blood flow to their leg muscles compared to a placebo group. 38% in one single dose. Here is the mechanism, and it is extraordinary. Beets are one of the richest natural sources of dietary nitrates on the planet. When you drink beet juice, those nitrates travel into your bloodstream where bacteria on your tongue and in your saliva convert them into nitrites, and your body then converts those nitrites into nitric oxide, the very same compound I mentioned earlier that your body produces less and less of with each passing decade. Beet juice essentially replenishes your body's nitric oxide supply through a completely external pathway that bypasses the age-related decline in your internal production. Think of it this way. Imagine your blood vessels are garden hoses, and nitric oxide is the handle that opens the flow valve. After 60, the handle gets rusty and harder to turn. After 70, it barely moves. Beet juice delivers a brand new handle every single time you drink it, and those vessels open up like they did when you were decades younger. What makes this particularly remarkable for people over 75 is that research from Wake Forest University found that beet juice specifically increased blood flow to the white matter regions of the brain as well, reducing the risk of cognitive decline, but its effects on leg muscle oxygenation were even more pronounced. Muscles in the legs of older adults who drank beet juice showed 11% greater efficiency in oxygen use, meaning the legs can do more work with less fatigue, less cramping, and less pain. I had a patient, Frank, 69 years old from Cleveland, Ohio, who was a retired steel worker and a proud man who hated asking for help. He had gotten to the point where he couldn't walk to the end of his driveway to get the mail without stopping to rest. After 3 weeks of drinking beet juice every morning, he walked 4 blocks to the corner store by himself for the first time in a year. He called my office just to tell me that call meant everything. Drink 4 to 8 ounces of cold-pressed beet juice in the morning, ideally 30 to 60 minutes before any physical activity or your morning walk. Do not use mouthwash before drinking beet juice. This is critical because antibacterial mouthwash kills the tongue bacteria responsible for converting nitrates to nitrites, and you will lose the majority of the benefit. Pair beet juice with a small amount of vitamin C and a food rich in folate like spinach, because folate supports the enzymatic conversion process that produces nitric oxide from nitrites. This combination creates a synergy that amplifies the effect by an estimated 25 to 40%, according to nutritional biochemistry research. And now, number 1, the most powerful circulation-boosting drink for seniors over 60, the one that has been studied the longest, validated the most extensively, and that I personally recommend to every single patient who walks through my door with vascular concerns. The answer is green tea, but not the way most people drink it, and not for the reasons most people think. A meta-analysis published in the European Journal of Clinical Nutrition reviewed 14 separate randomized controlled trials involving over 100 participants and concluded that regular green tea consumption was associated with a statistically significant reduction in systolic blood pressure, improved endothelial function, and a measurable increase in microvascular circulation, that's blood flow through the tiny capillaries deep in your leg tissue that are responsible for nourishing the muscle fibers and nerves. This is the circulation that conventional medicine rarely talks about, but it's the circulation that determines whether your legs feel alive or feel like dead weight by 3 o'clock in the afternoon. The active compounds responsible are called catechins, and the most powerful of them is EGCG, epigallocatechin, and gallet. Now that's a mouthful, so just remember, EGCG is what does the heavy lifting. Research from Tufts University Human Nutrition Research Center found that EGCG activates a gene pathway called the NRF2 pathway. Think of this as a master switch that turns on your body's own internal antioxidant defense systems. When this switch is activated in aging vascular tissue, it reduces the oxidative stress that stiffens and narrows your arteries. It also inhibits an enzyme called ACE-angiotensin converting enzyme, which is the same enzyme that many blood pressure medications target. Green tea does this naturally, gently, and without the side effects. After 65, your capillary density in leg muscle tissue begins to decline, meaning you literally have fewer tiny blood vessels delivering oxygen to your leg muscles than you did at 40. This is a major reason why so many seniors feel fatigue and weakness in the legs disproportionate to how much they're actually using them. EGCG in green tea has been shown to support angiogenesis, the formation of new blood vessel branches, particularly in response to physical activity, helping to partially reverse this age-related capillary loss. I want to tell you about Dorothy, 82 years old, from Savannah, Georgia. Dorothy had been told by 3 different doctors that her leg swelling, her restless nights, and her inability to stand for more than 10 minutes were just part of getting older. She started drinking 3 cups of properly brewed green tea daily, combined with gentle leg elevation exercises I gave her. Within 6 weeks, her leg swelling had reduced visibly. Within 10 weeks, she stood at her granddaughter's wedding reception for 2 hours. She danced one song she didn't think she'd ever get to dance. Here is exactly how to prepare it to maximize the EGCG content. Use loose leaf green tea, not tea bags. Whenever possible, loose leaf retains significantly more catechin content. Brew it in water that is hot but not boiling, ideally between 160 and 175 degrees Fahrenheit. Boiling water destroys up to 40% of the EGCG. Steep for 3 minutes exactly. Drink 2 to 3 cups daily, 1 in the morning, 1 early afternoon, and 1 optional cup around 4 p.m. Avoid drinking it within 2 hours of iron-rich meals, as catechins can temporarily reduce iron absorption. For synergy, add a slice of fresh lemon to each cup. The vitamin C in lemon juice stabilizes catechins in your digestive tract and increases their bioavailability by up to 80%, according to research from Purdue University. That is not a small enhancement. That nearly doubles what your body actually absorbs and uses. Now I want to take a moment and speak to you directly, heart to heart. You are watching this video because somewhere inside you haven't given up. You still believe that how you feel in your body is not fully out of your control, and you are right. I have watched patients in their late 70s and early 80s reclaim their ability to walk, to garden, to climb stairs, to play with grandchildren, simply by paying attention to what they put in their bodies every single day. Independence is not just a physical state, it is a form of dignity. It is the ability to live life on your own terms, to not need help with things you want to do yourself, to feel present and capable in your own body. That is worth fighting for. It is never too late to improve your circulation. It is never too late to feel better in your legs. The body, even at 80, even at 85, has a remarkable and scientifically documented capacity to respond to the right inputs. These 5 drinks, Tart cherry juice, ginger tea, pomegranate juice, beet juice, and green tea, are not magic. They are science, and the science says your body is ready to respond. If this video helped you today, please subscribe to this channel right now so you never miss a new video. Click that bell icon so you get notified every time we post. And leave me a comment below. I want to know, which of these 5 drinks are you going to try first? And again, drop your age so I know who I'm talking to. I read every comment. I am grateful for every single one of you who trusts me with your health. Stay well, stay strong, and I'll see you in the next video.